Hey, what's going on, everybody? For those of you who don't know me, my name is Dr. Jonathan Tyler Baker, and I teach history in the Department of Humanities at Central State University. And what you're about to see is a conversation between a student, Bryan Johnson, and I. We had an 8-week course together, sprint course over the summer. Bryan lives Long Island in New York. I'm here in Ohio, and we got together and he did an honors project through Central State's Honors College, where he basically took a topic, and the topic of interest to him was COVID-19, because he was a first responder during the pandemic. And he saw a lot of things that made him start thinking about how do we historicize COVID-19, meaning what is this moment, the pandemic, going to look like to the future when we're studying it as the past, but also to tease out some of the details about why COVID-19 disproportionately affected African Americans and other communities of color. I'm really excited for Bryan because he is getting his bachelor's degree online while holding down 3 jobs. He's got 2 kids, but he's passionate about this. And I'm really glad that I get to share it with you all. I hope you all enjoy our conversation. If you have any questions about it, you're more than welcome to reach out to me, or you can reach out to Bryan. I put both of our emails at the end of the video. I hope you all enjoy my conversation with Bryan Johnson. Okay, so welcome everybody. My first question for Bryan is, how did you get this whole thing started? Like, what was the problem that came to your mind that really made you want to do this research?
So obviously, the Honors College is new to Central State, and I'm looking to graduate with honors, but it gave me the opportunity, the unique opportunity, to really delve into something that's important to me. I work as a paramedic, and my goal here is to go on and be a physician assistant, and I want to I want to help people. And one of the things during the COVID-19 pandemic that was really rattling to me was that, and I'm sure that everybody in the class and you've heard about it, is that minorities and, most pertinent to this class, African Americans, were dying at a rate much higher than when compared to white people. And I believe the statistic, which was pretty staggering to me, was for every 10 white people that were hospitalized, 27 Black people were hospitalized.
Wow. Wow.
So, that's pretty staggering, and that's an issue. And I don't think that there should be disparities in this. And, this research hopefully, could help someone or help policymakers, dive deeper into this.
Yeah. So tell me a little bit about how you went just approaching such not only a new topic, but something that has a lot of disparate information sources. How did you go about getting all that together?
It's really hard. And I love reading medical research. It's something that I do in my off time because I have no life. I have 2 kids, but I have a whole new respect for them. Basically, it's very hard to tease out accurate information because you have to take into account biases. And unfortunately, with healthcare, it's become so politicized that you have to, weed out, is this left? Is this right? Where's the viewpoint of the researchers? I've had, and I don't want to say it's an advantage, but I've been in the middle of COVID from the beginning. I live in New York. My city and area that I work in was one of the first places in the nation that had, an epidemic before it was even really a pandemic. We had an epidemic in our area. So I've been in this, from the beginning. So I had the opportunity to see what was working, what wasn't working, and kind of see what the research was showing from the beginning, because I was personally invested in it. But it's a monumental task to search through data of COVID. And I'm just looking at small piece of COVID. I'm just looking at, racial disparities in COVID. I can't imagine, going and having to make like protocols and things based on a demographic. It's unbelievable.
Yeah. I could imagine. I could imagine. And just I'm sure people want to know, because I remember just watching the news and also reading the Times and just reading about comfort pulling into where was that at in Manhattan? The US that was docked. I don't know, like.
Yeah, I'm not sure exactly what port it
Mhm.
pulled into,
But the
but
scale, I mean, just thinking of the fact that like New York was in such a state of crisis that we had to bring in a military hospital ship.
yeah.
What did that look like on the ground? I mean, did you notice COVID taking a bias against different demographics even at the beginning of the pandemic?
So the area that I work, I live on Long Island and I work on Long Island.
Hmm.
And we were actually affected at the same time that New York City was affected because I'm in a county called Nassau, which
It's a
is
commuter
west.
county, right?
Yeah. And basically, I don't know if everybody remembers, but the first cases in New York were upstate. It was, I believe, a lawyer, and he had brought it down. And we have it was a Hasidic community, and we have a big Hasidic population on Long Island. So all this commingling, and we really got hit really hard just because of the spread and the nature of the disease. Um, but on the ground initially, I will say my first, we were calling them persons under investigation. That was like our term because we couldn't say definitively. It's very tough with COVID because the symptoms overlap with things such as influenza and the common cold. And, we didn't really know in the beginning. So we called these people PUI, or persons under investigation, somebody who was looking for confirmed COVID. And we really didn't have tests in the beginning either.
Yeah.
So we were just kind of winging it, and everybody had COVID. If you stubbed your toe, you had COVID until otherwise. But my first patient happened to be African American,
Mm.
and
Yeah.
she was very sick. She had a lot of comorbid diseases like COPD and diabetes and hypertension, and we didn't know that these were all risk factors for getting severely sick during COVID in the beginning. And looking back on it now, and especially when I was doing this research, I was like, well, it's pretty crazy. My first patient would happen to be African American, and as we go further into this talk, she hit all of the key points of why African Americans are so disproportionately affected. She was in public housing, she was in a multi-generational house, she had these comorbid diseases, all things that put African Americans in such a higher risk category.
Yeah, yeah, and I think it's actually a really good time to talk about that. So tell me, what did you find overall, and how does it relate back to what we were just talking about with I guess your technical patient zero for your occupation?
Yeah, so if we could relate this back to her, the first thing, and now I'm looking at this in hindsight,
Yeah, yeah.
hindsight's 2020. She lived in public housing, puts you at higher risk just because of the close proximity of people and the ventilation systems. She lived in a multi-generational household.
Mhm.
So she lived with her son and her grandson. And if I remember correctly, she had her grandchildren there too. And just that, we talk about 6 feet apart and social distancing. It's impossible to social distance when you have, a lot of people in the same residence, which makes the spread of this disease just even, it's exponentially higher when you have so many people in the same house.
Mhm.
Another social aspect that comes along with public housing is poverty. And there's a disproportionately higher rate of poverty in the African American community. And with poverty, while that's not necessarily a risk factor, poverty, does not create a breeding ground for healthcare, for
Mhm.
like primary care. So you know the poverty is not directly related, but it's indirectly related to these comorbid diseases. They're not able to seek primary care. They have a lack of access to healthcare
Mhm.
because whether it's lack of insurance, whether it's lack of transportation. And now we know, obviously, that diabetes, hypertension, any type
Mhm.
of respiratory diseases, and we know asthma is very prevalent in the African American community, puts you at high risk of hospitalization and dying
Yeah.
from COVID. So this patient hit all of these boxes. She had all of these things, and she was very sick. I don't know exactly what her. Oh, actually, I'm lying. I do know her outcome because I wound up picking her up over a year later. And I'm like, oh my God, I remember you. And she's like, yeah. She's like, isn't that so crazy that it was,
What a twist of fate. Yeah.
um, I work in it's called the city of Long Beach. I don't want to say it's a tourist town. They have about a population of like 30,000 people.
Hmm.
We only have one paid ambulance. So we run into the same people, especially the people that are chronically sick over and over again. So
Yeah.
I have the fortunate ability to see people that I've treated previously and like, hey, how you doing? What happened? You know?
Yeah. Yeah.
So, and this lady was just very appreciative. She's a very sweet lady, and her son was there, and everybody was there in the beginning. And just looking back, almost laughing, like, "Hey, you remember that? That was really scary. We had no idea what
Yeah.
was going on."
Did we learn anything historical about COVID? Like, is this a thing that happened that hurt the African American community because of just historical reasons and it was a perfect healthcare storm? Or are there a lot of other things going on here?
Anything, any problem, it seems like today that the politicians and people will say, here's the quick fix. This is what we're going to do, and it's going to fix everything.
Mhm.
And that is not the case. And it's the same thing with COVID. There are so many aspects to this disease, and that caused it to disproportionately affect African Americans, and it's terrible. And I don't want to be doom and gloom, but there's going to have to be a lot of changes over a period of time in order for things to get better and things to never happen like this again, because this is unprecedented and something that we never want to happen again. And to tie it into this class, because this would be totally for nothing if I didn't tie it into history, but this does have historic roots. Obviously, history, anybody would be misguided and almost you can never say that history doesn't affect the present.
Mhm.
It doesn't. And we had the opportunity to speak previously, and something that you brought up was generational capital.
So you had brought up generational wealth, and then we had talked about cultural capital. You being able to participate in society and all these different institutions, right? There's the cultural capital you get from that, but just within the Black community, you see a lot of cultural capital being passed, or social capital, where you have, grandparents or parents saying, we don't know what outcome could happen. There's a lot of history there, historic racism, but then institutional racism, and how institutional racism is something that like could be embedded and is a problem, but you also have to deal with like the historic racism that a lot of Black folks have internalized,
Right.
to be like, no, no way. We have heard and seen enough of the institutional racism. And so you have to deal with it at an individual level and at
Right.
this systemic institutional level.
I mean, even if you look at healthcare, historically, healthcare has done terrible things to the African American community. I mean, you look at I believe it was the Tuskegee experiment, where they
Mhm.
injected unknowing, unwilling participants with syphilis and just said, let's see what happens. And they were all African American, and it's terrible. It's
Mhm.
terrible. And these type of things that we did have created this historic distrust in healthcare, and you can see this throughout any of the other institutions that America has. I think that we've made great strides in what we did, but since those terrible things, but we have a lot of work to do.
And just your unbridled, unfiltered opinion, what do you think needs to be done, or what can be done in order to correct what we both, I think, see as an injustice?
Yeah, it's terrible. And I don't even want to just isolate it to the African American community. I mean, if
Mhm.
you look at, we spoke about Native Americans.
Mhm.
This is a problem with Native Americans. It's a problem with Latinos. It's a problem of minority communities. I think that it definitely has a lot to do with poverty and wealth, because these are areas that are traditionally have a higher rate of poverty, so
Mhm.
a higher rate of uninsured. They have a higher rate of lack of primary care, so that chronic diseases go either unnoticed or untreated. So
Yeah.
that's a big problem. And It's pretty interesting because public policy is very interesting to me, and politicians always bring up, cost. And
Yeah.
when you look at studies on primary care, if we were to give people insurance, who traditionally don't have insurance, it would be cheaper for us to insure them than it would be to treat these chronic diseases. Because what happens is this all falls on the emergency department later on in the hospitals, and you create this exorbitant cost because you have, the testing costs more in a hospital. You pay for the bed, you pay for all these extra costs that you wouldn't pay at a care office. But I don't know. Me and you spoke about this before. I don't know if universal healthcare is a fix, because if you look at some of these other nations where universal healthcare, exists, they have higher rates of morbidity and mortality for certain things like cancer and heart disease. So for us to fix this now, I don't think it's going to happen. I think we're going to need to come together, and we're going to have a sharing of ideas and opinions, and we're going to have, and I don't mean this just in the healthcare community. I don't mean this in just, the policymakers. It's going to have to be a joint effort.
Yeah,
No doubt it's going to have to be a joint effort. It's going to have to be a joint conversation, and it's going to be a long conversation. And we're all going to have to make, compromises, because what we're doing now, especially, it's no secret that the right is so far right and the left is so far left, and we're just butting heads, and no progress is being made at all. And it's really, all it's harming is us. It's harming the citizens. It's harming everybody.
Bryan, thank you so much for the conversation, for doing this, for taking the time to chat with me, and to give your time and what you're doing here to, the rest of the course. That means a lot. And then also, if you ever have any questions about healthcare in general or COVID, Bryan, do you want them to reach out to you if they have any questions about that? Do you have any resources they can look at? Some good places you can go for good, honest healthcare information?
Honestly, and I mean this, I know people are like, oh yeah, you could reach out to me, and they don't really want people to reach out. If anybody ever emailed me or wanted to message me about anything, I would be more than happy to share my resources and things, not necessarily that are just applicable to healthcare, but resources as far as navigating the healthcare system. I think it's really important. I think it's something that every healthcare provider has an obligation to do. And I just also wanted to say that this class has been awesome. I think that it was very interesting to see how people had differing of opinions. And then when we would, and even on the discussion boards, like it's so weird not being in a traditional class setting, but we'd see in the discussion boards, it was all civil discourse, and it was all, idea generating. Like, I'd post something, somebody post something on it, and I'd be like, hey, I didn't look at it this way. So it's definitely cool. I think that this is obviously the way of the future and how learning is going to be, especially people are so busy and doing so many jobs, and this is how we're all going to have to interact, and especially when we're at different ends of the world.
Indeed. Yeah. And it proves that even if you're on online education, you can still do an honors project and get an honors diploma, right? How fun is that?
Yeah, I think it's awesome. And I would, I reached out to Lamont, and I've talked back and forth with them, and they're very, very receptive, very open. And I would encourage anybody in the class who's looking at this to join. I mean, it's just another eventual, star on that diploma and star on your resume. Hey, this was an honors college. They really, they cared about their education.
Indeed. Hey, good deal. Well, Bryan, this has been a lot of fun. Thank you so much. And I will talk to you soon. Okay, man?
Yeah, thank you. Thanks for having me.
Bye-bye.